Hi, my name is Divya, and I'm doing my PSA on spray on tans. So how does the spray work? Here you can see this is the instrument professionally use at salons to spray this on the skin to tan it. So the chemistry of the fake tan. The liquid itself, it contains two active ingredients called the dihydroxyetazone and the erythrulose. Both of them, the dihydro one, it is also known as the DHA, and both of them combine to react with free amino groups of amino acids, peptides, proteins, just on the upper layer of the skin called the stratum corneum. The reaction itself is called the Maillard reaction. Another name for it is the non-enzymatic browning. So basically, the higher the concentration of the DHA, the darker the tan will be. So now we have the process of the tan. Here is a basic tanning salon called Baked, conveniently named. But what you do is when you go over there, make an appointment, they ask you about your skin type, thickness, any medications you've been using, and how moisturized or dry your skin is. These all factors affect the final tan that you have. So they would need to know if the DHA level would need to be higher or lower. Also, your preference counts. If you need your tan to be darker, then more DHA would be required. This process usually takes about 20 minutes, and the tan itself lasts about 7 to 10 days, maybe even less if you shower earlier than about 8 hours, or you don't put on loose clothing, or you don't follow directions, as in no hard rubbing. Nothing should come in contact with the tan itself, with the skin that's tanned itself, as much as possible. So here we have a woman who has undergone a spray tan. You might not see that there's something extremely wrong with this picture and the way she tanned, because although DHA is FDA approved, it has many that is also included with that. There's an exception that says that it cannot be ingested or inhaled, and that means that it should not be in the bloodstream. It should not come in contact with anything that goes into the bloodstream, such as the eyes, the nose, and the mouth here. And what is extremely wrong with this picture is that it is clear that she has not used any protective equipment to protect herself from the toxic DHA that I'm sure has gone into her bloodstream and her lungs by inferring this picture. So the problem with the whole protective equipment is that most tanning salons do not have it, or they advise that you don't use it because it affects the appearance of the tan itself. As in, if she had used a protective equipment, this whole part would be her normal skin tone, which would look kind of odd. So most salons advise you not to use it. Also, another point is that the DHA, a lot of people claim that the DHA is safe to ingest, but this is a large misconception, because when people say that, they are confusing two very different types of DHA. One, the DHA that is in the tanning liquid, and the other one is called docosahexaenoic acid. This is a dietary supplement, and it's also abbreviated as DHA. So this one is, of course, as a dietary supplement, it is safe to ingest. And when most people claim that DHA is safe to ingest, they are confusing these two. Other than that, there are no other known risks since it is FDA approved. There's no risks other than as long as it is on the outer part of your body. It's for only external use, basically. But otherwise, if it does go into your bloodstream, it can cause many types of dire issues, such as genetic alteration, which later leads to birth defects, even DNA damage, because that's how toxic the DHA itself is. And if it goes into your lungs, that causes cancer, tumors, and many other issues. So if if someone does 1 to 10, the safest way to do 10 is to use protective equipment to exclude or to prevent the DHA from going to the eyes, the nose, and the mouth. Happy tanning. Thank you.